Welcome to today's update on COVID-19. Bon après-midi tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le ministre de la Santé, Dorothy Shephard. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Dr. Russell.
Thanks, Bruce. Merci. Good afternoon. Bon après-midi à toutes et à tous. Depuis un mois, des mesures coupe-circuit sont en vigueur dans plusieurs régions du Nouveau-Brunswick dans le but de ralentir la propagation du virus responsable de la COVID-19. Ces mesures sont généralement avérées efficaces pour repousser la quatrième vague de cette pandémie. Le nombre de nouveaux cas a diminué dans l'ensemble de la province et le nombre de cas actifs a été réduit de moitié. For the past month, several regions of New Brunswick have been under circuit breaker measures aimed to slow the spread of the COVID-19 virus. Overall, these measures have proven effective in rolling back the fourth wave of this pandemic, and we have seen a decline in the number of new cases across the province, and our active caseload has been reduced by half. Hospitalizations and ICU admissions have also declined. Last week, we were able to lift the circuit breaker restrictions in the Campbellton, Madawaska, and Upper St. John River Valley areas. But progress has not been uniform across the province, and COVID-19 infections continue to grow in some areas. So I'm going to show some slides. So I'll show you the situation in 3 areas of New Brunswick where our concern is the highest currently. So the first slide shows an image of Zone 2 and the progress of cases, again, which is the St. John and surrounding area. So as you can see, the black line on the graph shows the rolling 7-day average of new cases reported in the area each day. And you can see that the trend in new cases has been declining, which shows the measures put in place have had their desired effect. Il y a une recrudescence de cas aujourd'hui. Notre laboratoire a confirmé les résultats positifs d'un certain nombre de personnes ayant subi un test de dépistage rapide. Comme ces personnes s'isolaient déjà, nous avons confiance que la tendance générale de la baisse du nombre de cas se poursuivit. There is an uptick in cases today, and where a number of people whose infections were first detected by a rapid test have been confirmed by our lab. So these individuals were already self-isolating, their contacts had been traced, and we are confident that the overall trend toward fewer cases should continue. So the next slide is showing the trend in Zone 7, which is the Miramichi area. And you can see that the cases have risen sharply, and for that reason, it means that we will need a stronger effort to bend this curve. And the very last image we're showing is the trend in Zone 1, which is the Moncton and southeastern New Brunswick area. This area has been under circuit breaker restrictions since October 8th, which is a very long time in the grand scheme of things. So, malgré ces restrictions, le nombre de cas demeure élevé, particulièrement dans le secteur du Grand Moncton. Nous savons qu'il y a des cas de transmission communautaire dans ce secteur, c'est-à-dire des cas qu'il est impossible de retracer avec certitude à une source connue. Plus de la moitié des cas signalés dans ce secteur sont transmis au sein d'un ménage. Despite these restrictions, the number of cases remains elevated, particularly in the greater Moncton area. We know that there is community transmission and community spread in this area, and that means that cases that we cannot identify in terms of definitively tracing them back to a known source. More than half of the cases we have seen in this area are happening within households. We are seeing the virus spread within families and then spread again through social contacts. Now, if everyone was following the circuit breaker restrictions by limiting their close contacts to their immediate household, technically speaking, this outbreak should have been significantly reduced by this point. And I think it really speaks to the issue around it's a small number of people that can impact a larger group and a larger region, a larger zone, and the hospital system in general. And we've seen that in other waves, so it's not new. Le fait que cette éclosion ne s'affaiblit pas me porte à croire que de nombreuses personnes ne respectent pas les règles de mesures coupe-circuit. Ainsi, l'éclosion de COVID-19 se prolonge à Moncton, à Dieppe et à Riverview. Puis ça veut dire qu'il y a certains gens qui font des décisions qui ont des impacts sur la population de la Grande Moncton et sur le système de santé. The fact that it has not means that enough people are following the circuit breaker rules. So meaning we were expecting that if everybody was following the circuit breaker rules, we would start to see a decline in case numbers. But the prolonging of the COVID-19 outbreak in Moncton, Dieppe, and Riverview is continuing. It is vital that New Brunswickers in circuit breaker areas adhere to public health guidance and advice. We need a renewed effort to slow the spread of the virus by reducing contact between people. And again, I think the majority of people are doing this, but for those people who aren't, it's having a huge impact on this community. By limiting your close contacts to your immediate household, you are denying the virus the opportunity to spread and infect others outside of your home. We need everyone in the circuit breakers to commit themselves to reducing contacts so that we can limit the spread of COVID-19. Aujourd'hui, Santé publique confirme qu'il y a 69 nouveaux cas de COVID-19 au Nouveau-Brunswick. Avec 44 rétablissements, le nombre de cas actifs dans la province s'élève aujourd'hui à 548. Le nombre d'hospitalisations s'est stabilisé. Il y a présentement 17 citoyens du Nouveau-Brunswick hospitalisés en raison de la COVID-19, dont 11 aux soins intensifs. Today, Public Health has reported 69 new cases of COVID-19 in New Brunswick. With 44 recoveries, the number of active cases in the province stands at 548. Hospitalizations have leveled off, with 17 New Brunswickers now in hospital due to COVID-19 and 11 now in ICU. This is a huge improvement over what we have seen over the past month, but we need to reduce these numbers even further before all restrictions can be lifted. Following public health guidance and advice, this will help to slow the spread of the virus. So please limit your close contacts, particularly those of you living in the circuit breaker areas. Wear a mask when you are in public and maintain 2 meters of, a public place, and maintain 2 meters of physical distance from others whenever possible. Wash your hands regularly and thoroughly, and stay at home if you feel unwell. We are still seeing people going to work for an entire week with symptoms. This is causing transmission. We need people to get tested. That's what the point of care tests are for, and we do have great access to PCR testing at the moment. So please watch for those COVID-19 symptoms and seek testing when symptoms emerge. Make sure that you and your loved ones are fully vaccinated. This is the most effective tool we have to slow the spread of COVID-19 and prevent serious illness, hospitalization, and death. En date d'aujourd'hui, 86,2% des citoyens du Nouveau-Brunswick sont pleinement vaccinés contre la COVID-19 et 93% d'entre eux ont reçu une première dose d'un vaccin. Il est clair que les vaccins ont contribué à la prévention de graves maladies. As of today, 86.2% of New Brunswickers are fully vaccinated and 93% have had at least one dose. Vaccinations have clearly helped to prevent serious illness. During the first months of the pandemic, before vaccines became widely available, we saw up to 12% of COVID-19 cases admitted to hospital. Since vaccines were introduced, that number has dropped to 2%. This means that while we see more cases of COVID-19, the number of infected people who will suffer severe impacts from the virus will be proportionately less. And so if everyone who has had their first dose commits to getting a second shot, we will all be much better protected against the most serious impacts of COVID-19. To maintain the effectiveness of the vaccine, booster doses are being made available to priority groups. And we have started with the most vulnerable to this disease, particularly the frail, elderly, and those with immune-compromising conditions. We have now provided booster shots to all nursing home residents in the province. We are making substantial progress in providing boosters to residents of special care homes, with more than 80% of the facilities conducting third-dose clinics. New Brunswickers over the age of 65 are now eligible for a booster as long as at least 6 months have passed since their second shot. We are also offering mRNA boosters to those who have received the AstraZeneca vaccine as their first or second shot. À compter de cette semaine, les citoyens du Nouveau-Brunswick qui doivent voyager à l'échelle internationale pour le travail, l'éducation ou les soins de santé seront admissibles à recevoir une dose de rappel. De nombreux citoyens de la province ont reçu des doses de différentes marques de vaccins au début de notre campagne de vaccination. Cette flexibilité nous a permis de vacciner davantage de gens plus rapidement. This week, we are extending eligibility for booster shots to New Brunswickers who are required to travel internationally for work, education, or healthcare. Many New Brunswickers received mixed doses of different vaccine brands in the initial rollout of our vaccine program, and that flexibility enabled us to vaccinate more people at a faster rate. People with mixed doses are recognized as fully vaccinated in Canada and the United States. However, there are countries which only recognize vaccination from a single source or require a booster for those who receive two different types of vaccines. If you are required to travel outside of North America for work, education, or medical procedures, you can receive a booster of an mRNA vaccine as long as a 28-day interval has passed since your second dose. To receive this booster, you're required to provide a letter from your employer, physician, or educational institution that demonstrates that your travel outside of North America is essential. Appointments can be scheduled at an RHA vaccination clinic, through an online booking system or at a participating pharmacy. My apologies. I know that the circuit breaker restrictions are very hard to live with. They disrupt the pattern of everyday life and hamper our ability to maintain contact with those around us, which is so important for our mental health. And I don't want to see these restrictions continue a day longer than necessary. But right now they are necessary to slow the spread of COVID-19. If we all work together to support one another in following public health advice, we can turn the tide in this fourth wave in every corner of our province. Thank you very much.
Good afternoon. Bonjour. Overall, the number of active cases and hospitalizations have stabilized, which is reassuring. However, as Dr. Russell explained, we still have areas of concern in our province. We are seeing an increase in active cases in Zone 7, the Miramichi region. Currently, that zone has case activity that is comparable to other regions when they went into circuit breaker measures, and the cases, unfortunately, are increasing. As well, we are seeing household transmission continues to be the major cause of new cases in Zone 1, the Moncton area, which is in a circuit breaker and has been for several weeks. De plus, nous voyons que la transmission dans les maisons privées continue d'être la grande cause du nouveau cas dans la zone 1. La région de Moncton qui fait pourtant l'objet de mesures coupe-circuit depuis plusieurs semaines. On advice of public health, beginning on Friday at 6 p.m., a 14-day circuit breaker will come into effect in all of Zone 7, with the exception of Black River Bridge and communities to the east, Murray Settlement and areas south, and New Jersey and communities north. As well, circuit breaker measures will remain in effect for at least another 7 days in Zone 1, but to be reduced to the area covering the municipalities of Moncton, Dieppe, and Riverview. Circuit breaker measures in the other areas of Zone 1 will end on Friday at 6 p.m. The large section of Zone 2, the St. John region, that began circuit breaker measures on October the 29th, have experienced a noticeable improvement. This is why circuit breaker measures will end in Zone 2 as of 6 p.m. on Friday evening. Circuit breaker measures work, but only if everyone is following the rules. Les mesures coupe-circuit fonctionnent, mais juste si tout le monde respecte les règles. For those living in circuit breaker areas, you must limit your contacts to a single household, which includes individuals living together, caregivers from any members of the household, or any parent, child, sibling, grandparent, or grandchild living outside the household who requires support. No private indoor or outdoor gatherings are permitted. Travel to or from circuit breaker regions is restricted, except for those who must travel for essential reasons, including work, health services, child custody, child care, or post-secondary education, or travel to events where proof of vaccination is required. Businesses, entertainment centers, and events may remain open and can continue to admit people who show proof of full vaccination and a government-issued ID. Children under 12, accompanied by a fully vaccinated adult, will also be admitted. I am very concerned for the Moncton area. We have had a month of circuit breaker restrictions, and cases continue to be stubbornly high, with the major cause in more than half of those cases being household transmission. Les régions de Moncton m'inquiètent beaucoup. Les restrictions coupe-circuit sont en plus depuis un mois à la caresse très élevée. La transmission dans les maisons privées est responsable de plus de la moitié de ces cas. With one household bubble in effect, we shouldn't be seeing that to these levels. We will be increasing enforcement to ensure those who are supposed to be isolating are doing so, and to make sure that no household gatherings are taking place. If you see violations of the rules, I encourage you to call 1-844-462-8387 or email helpaid@gnb.ca. The health and safety of our communities is at stake. The Delta variant is still with us, and it will take advantage of any opportunity to spread. This is why we must all follow whatever measures are in place and get vaccinated, so we don't give it that opportunity. La variant Delta a toujours parmi nous, et il prend toutes les occasions de se propager. C'est pourquoi nous devons survivre toutes les mesures en place et nous devons nous faire vacciner pour ne pas leur donner cette occasion. I want to thank everyone for doing their part. I know it isn't easy, especially after 20 months of this pandemic, but it is still necessary. Working together, we can get through this. Tomorrow is Remembrance Day, a day set aside to remember those who have fought and died in service to our country. It is important to take time to honor the brave men and women who sacrifice so much in defense of Canada. We have much to be grateful for, thanks in large part to our veterans and those serving in Canada's armed forces. Il est important de prendre le temps de rendre hommage aux femmes et aux hommes courageux qui ont fait tant de sacrifices pour défendre le Canada. Nous avons tant de raisons d'être reconnaissants, grâce en grande partie à nos anciens combattants et aux gens qui servent de la force armée canadienne. Remembrance Day is the perfect time to reflect, to remember those we have lost, as well as to pay our respects to those who continue to keep us safe and the families who support them. Thank you. Merci.
Merci beaucoup, Minister Shephard and Dr. Russell. Thank you very much, Minister Shephard and Dr. Russell. We'll now proceed with questions from members of the media. You have the right to pose your question in the official language of your choice. Each reporter will have one question and a quick follow-up. Nous allons maintenant procéder aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question et un suivi. On va commencer avec M. Frédéric Camarano de Radio-Canada. M. Camarano. On va retourner à M. Camarano. We'll now proceed to Tim Rosell with Global TV.
Thank you, Bruce. My question is for Dr. Russell. Dr. Russell, just given where the case counts are right now and the fact that we've seen a little bit of an uptick over the last week or so in active cases, how tempting was it to keep circuit breakers in place even in some of those areas that have shown considerable improvement, in particular the areas that are coming out of the circuit breakers in Zone 1 and in Zone 2?
Well, I can say that from the analysis that we've been doing epidemiologically, again, we're trying to focus on the high-risk situations. So that's what's driving our decisions right now. You know, I think it's not unreasonable to think that we will be able to use circuit breakers for the time being, but overall, moving forward, we probably will have to have some discussions about what we can do in perpetuity over the course of the next 3 to 6 months, knowing what's happening globally and knowing what's happening in the rest of Canada.
Thank you. Mr. Rosell, do you have a follow-up today?
Yes, just a brief one, Bruce. Thank you. And it's for either Dr. Russell or Minister Shephard, whichever wants, or both, I suppose. Just wondering, now that the CUPE strike has entered its second week or so, how is the healthcare system managing? I know that that there is legislation in place for healthcare workers to go back, but is the system managing, and are those kinks that were identified with people showing up for work and being turned away, have those been ironed out?
I can take that, Tim. Absolutely. The hospitals are certainly managing much better than they have been. You know, laundry's back to quite normal type levels. The cleaning and the sanitation issues have pretty much been resolved. And I must say that all of the employees have been extremely professional on this time. We, with regard to, I'm sorry, the second part of your question, what was that? Tim?
I think you've kind of addressed it, to be honest with you, but thank you.
Okay, yeah, they're doing much better, and we get monthly, or I'm sorry, morning and afternoon reports, and right now things are quite good.
Thank you.
Thank you both. Frédéric Camarano.
Vous m'entendez maintenant?
Oui, plus fort, merci.
Est-ce que vous pouvez m'entendre maintenant?
Oui, plus fort.
Oui, d'accord. Donc, je voulais savoir, pour la ministre de la Santé ou la médecin hygiéniste en chef, peu importe, quel sera le critère pour que Moncton, Dieppe et Riverview puissent ne plus avoir à respecter les mesures coupe-circuit?
Alors, à ce moment-ci, on aurait voulu voir les nombres de cas diminuer à ce moment-ci, après toutes les mesures qui ont mis en place depuis le 8 octobre. Mais le fait qu'on ne voit pas les nombres de cas diminuer, ça veut dire qu'il y a encore des mesures qui devront demeurer en place pour le moment, et on va augmenter notre capacité de vraiment faire certaine que les gens suivent les directives, les ordres de santé publique au niveau de l'auto-isolement, parce qu'on sait que la transmission à des maisons avec des rassemblements, etc., ça ne devrait pas se passer à ce moment-ci. Alors, la seule façon de régler cette situation et vraiment diminuer les risques à ce moment-ci, c'est faire certaine que les gens on veut que les gens continuent à faire à suivre les mesures, ceux qui font ça depuis le commencement de les mesures le 8 octobre, mais pour ceux et celles qui ne suivent pas les mesures de santé publique à ce moment-ci, ni les ordres pour l'auto-isolement, ni d'avoir des rassemblements à la maison privée, c'est dans ce temps-là qu'on va avoir l'aide de le département de santé, de sécurité publique pour faire certaine que ces règlements, les ordres sont respectés.
Monsieur Camarano, as-tu un suivi?
Oui, j'aimerais savoir, pour ce qui est des cas dans la zone 1, dans quelle proportion ils sont divisés entre Moncton, Riverview, Dieppe et le reste de la zone 1?
Je ne sais pas si j'ai tous les nombres ici devant moi, mais je peux les procurer après la conférence de presse, je crois.
D'accord, merci.
Ah, alors je ne l'ai pas. C'est pas quelque chose on n'a pas les zones directement impactées dans cette spécifiquement comme vous le demandez.
Merci.
Merci. We're now going to go to Vicky Hogarth of CHCO TV.
Thank you, Bruce. Can you hear me?
Yes, thank you.
Dr. Russell, when it comes to booster shots, is there a preference based on what the person had before? So should a person who had 2 Pfizer shots get a Pfizer or a Moderna for a third dose? And what about people who've had a mix of Pfizer and Moderna? Does it matter what they get as a third dose, or is there an ideal combination?
I think, as you've seen with the rollout throughout the pandemic, we've wanted to make sure that we can maximize the number of people that get doses in arms as quickly as possible. So in some cases, you're right, that has meant that we've mixed those doses. At this point, I think it does not matter which one you get as your booster, but there are some criteria that we do need to adhere to, which I did go through in my notes. But certainly, as of right now, we want people to know that they're available and how to register and get access to them. But again, you know, in the longer term with international travel and what people need in terms of that recognition of having at least two the same, it's for some people that will be possible. And so that's, in most cases, you'll end up having at least two the same, if not three.
Thank you. Ms. Hogarth, do you have a follow-up today?
I do. Now with rapid tests having been available for a significant amount of time to the public, do we know approximately how many New Brunswickers booked PCR tests after first testing positive with like a home use rapid test? And do you consider this this strategy of bringing in rapid tests for the public successful in that regard?
I consider it a success right now, simply because even during the period of labor action, et cetera, where we really had to do risk mitigation in terms of making sure that we had the exact number of resources, the bare minimum that we could function with in terms of making sure that everybody who needed to get tested was prioritized appropriately. So during that time, the people who did get tested with the point of care tests and then did get a confirmatory test, that has worked very well. So when that process works well, then we're confident that it's an adjunct to the PCR testing that we're doing in Augmented, and then we capture that confirmatory PCR test after the POCT test. It's, again, I think as of right now, we're pleased with how that's been rolling out.
Thank you. Laura Lyle with CTV.
Thank you, Bruce. Can you hear me?
Yes, thank you.
This question is for Minister Shephard. Could you elaborate on the enforcement measures that are going into effect in parts of the Moncton region? What will it look like, and what can people expect?
So we will be working with our public safety partners to, it's really just about, in this case, it's observance or responding to official complaints. But also we have a number of people who are isolating, and they will be in person checking up on many of the people who are supposed to be isolating to ensure that that's happening. It's extremely important that we try to get a handle on the number of cases in the Moncton region, and we're going to have to take this next step to try to get compliance.
Ms. Lyle, do you have a follow-up?
I do. I'm wondering if we're seeing any sort of backlog in testing requests for PCR tests, and if so, if that may be impacting the full picture of our active case count in the province.
No, I can tell you that certainly as of yesterday, and maybe even before that, that all of our PCR testing was caught up. Certainly, and then the priority groups were moving through quite smoothly. So I don't think it is. I think we're seeing that the transmission, over 50% of the cases are transmitted household to household, and so it's really about trying to be disciplined, trying to stay true to the course that we collectively have in keeping the spread of COVID-19 to a minimum. And the way we can do that is to keep our contacts down, and in the case of circuit breakers, keep it limited to one household.
Thank you both. Nathan DeLong, Miramichi Leader, Brunswick News.
Good afternoon. Can you hear me okay?
Yes, loud and clear.
Excellent. My question is for either Dr. Russell or Minister Shephard, whichever of you can answer. I'm curious about what has changed since last week, when there was a lot of speculation that the circuit breaker measures that you announced for Zone 7 were coming. What has changed since last week when you stated that the circuit breaker measures were not required for Zone 7?
Well, I'll start, and Dr. Russell can pick up if I miss anything. But the fact is that at that time, the outbreaks in Miramichi were really segregated to two outbreaks, and public health locally felt that they They had the contact tracing underhand. They had the cases understood. So as time progresses, we monitor it. That's why it's monitored on a daily basis. That's why we meet weekly. And if we have to make changes, then we do. But, restrictions are hard. They're hard on everybody. And we want to implement them when it's absolutely necessary. So that's those are the decisions that we make day in and day out in trying to keep ourselves flexible and keep ourselves understanding the local situations so that those decisions can be made with public health's guidance.
I can add to that. So, yeah, the public health team in that region has been working tirelessly in terms of making all the efforts to protect the population there. And even with all of that work, we're still seeing the case numbers going up. So again, there comes a point where we just, again, need to make sure that we need to do absolutely everything that we have in our ability to address that risk right now. So again, that was taken into account with our risk assessment.
Thank you both. Mr. DeLong, do you have a follow-up?
Yes, I do. Thank you, Bruce. We're hearing a lot of questions from locals in Zone 7 on why the number of potential public exposure alerts may seem somewhat low compared to the number of cases being reported in Zone 7 and the number of active cases currently in that zone. Have the procedures for contact tracing and exposure alerts changed? If so, why is that?
To my knowledge, there hasn't been a change. Again, we're in touch with our partners in the regions every day, several times a day. So again, we have the same processes across the province in terms of how we deal with contacts, close contacts and contact tracing. And as soon as we receive the information around exposure sites and situations, then that is when we post it publicly.
Thank you both.
Thank you.
Mia Urquhart, CBC.
Thanks, Bruce. My question is for Dr. Russell. Clearly, the circuit breaker in Moncton is not working. So where do you go from there? Is it just about enforcement, or are there other measures that can be put in place to bring the numbers down?
Well, throughout most situations that involve public health, the measures have to match the risks, and we do it in a stepwise, incremental fashion in terms of how we escalate. So at this point in time, those are the next steps, and that's why we chose that that focus in terms of targeting the risks that we are aware of right now in Zone 1.
I can just add to that, if I could, that every time we put a zone into a circuit breaker or an area of the province into a circuit breaker, Dr. Russell and the team at Public Health meet with, usually virtually, with local leadership to tell them and explain the situation, explain the boundaries that they're going to be utilizing. And I do know that Dr. Russell and the team are going to put an even stronger effort in reaching out with, with our local leaderships, maybe the Regional Service Commission, as we've done in other areas like Campbellton and Edmundston when we've had difficult things to deal with. So while they're always kept in the loop, we're going to be making an extra effort to ask for their help in delivering the messages that we know these are difficult restrictions to live by and to guide us, but they're absolutely necessary for the safety of not only our community, but our hospitals.
Thank you. Ms. Urquhart, do you have a follow-up?
I do, thank you. Daily cases seem to have stopped declining in New Brunswick and elsewhere. Some places are even seeing an uptick. So what's the projection for New Brunswick? How do you see the fourth wave playing out here, and for how long?
So with respect to specifically today's numbers, there are a few captured in today's numbers that are actually just confirmatory tests from point of care tests that were done in the last several days. So we were expecting those ones to turn up positive, but in terms of the active case number that's reported, we don't report on the POCT positive ones until they're confirmatory, but in terms of the management of those cases, it's identical to a positive PCR case because we presume we're calling them presumptive cases. So so in terms of today's specifically, I would just take that with a grain of salt in terms of the number specifically today. The projections that we had in the last month, we showed 3 different graphs around what could happen with our hospitalizations based on the number of cases, based on how effectively people reduced their numbers of close contacts. So we've actually seen that curve followed very specifically along the lowest curve in terms of the best outcomes for hospitalizations right now. And that really is as a result of the population mostly reducing their close contacts by about 50 to 60%. So those measures have worked overall, again, in terms of the outcomes we're seeing now in terms of numbers of people hospitalized and in ICU. And again, overall, the active case numbers have come down.
Can I just add to that? You know, a group of unsung heroes in this pandemic, and I know Dr. Russell will agree with me. There's so many people behind the scenes of public health, including the epidemiological team, who work absolutely tirelessly to provide us with models and predictions of where things may go if this happens, if that happens. And they are key to helping us make decisions on a day-to-day basis, and in particularly when we get to cabinet. So I just want to give a shout out to the epidemiological team that is really a part of our base in helping us through COVID.
Ms. Urquhart, do you have a follow?
Sure, but that would be 3.
Oh, sorry, then. Thanks for keeping me honest. We're going to move to Savannah Odd with the Telegraph Journal.
You need a coffee, Bruce.
He probably needs a few.
Don't we all? My first question is for, I guess, Dr. Russell or the minister. Are you able to give a sense of, I guess, the number of PCR tests done, or maybe a weekly average for the last few weeks of strike action, and sort of how that compares with the test processing rate before that?
I'll start. Because we knew that the PCR testing was going to be impacted, we had a very specific risk mitigation process to allow for us to continue to be very confident that the riskiest, the people that public health felt were at the highest risk for being COVID positive would still get tested. And again, that in conjunction with the POCT testing and then the confirmatory testing, I think we did a great job of making sure that the highest risk groups were tested when they needed to be. So, but there definitely was a huge drop in terms of the amount of PCR testing that was done compared to prior to the labor action. But again, we met many times to make sure that whatever risk mitigation processes we need to put in place, we did put in place, so that offset most of that decrease with respect to PCR testing. You know, time will tell. We did, again, the confirmatory tests are reassuring in the sense that those people who did POCT testing and then got their confirmatory PCR test, we captured many cases that way. So so our efforts collaboratively with those pieces of work have so far proven to be productive, and so we're pleased with that.
And I'm just going to add that, you know, the POCT tests are really going to be a part of our future. It's going to be a part living with COVID. And so as of this morning, we had distributed 103,703 point of care testing kits. And so, you know, times that by 5, we have 500,000 tests out there in the hands of New Brunswickers. So they can help help keep an eye on this and respond accordingly as they have been doing. And it will be a part of us living with COVID.
Thank you. Ms. Odd, your follow-up question.
Thank you. So yesterday, Public Health had said that nursing homes, all nursing homes had been offered a COVID booster shot. Do you know the rate of uptake for nursing home residents, and as well how many staff would have opted for that booster shot?
I'm not sure that I have the actual breakdown of staff, but I do know that 100% of our nursing homes have received their booster shots, and 82% of our long-term care facilities, as of yesterday, had received their booster shots. So we, Savannah, we'll try to get you the numbers on the number of residents and number of staffing who are vaccinated.
Sorry, so when you say 100% had received the shot, you don't mean 100% of residents?
I mean 100% of the homes, of nursing homes, has had their, their round of booster shots.
So received the actual supply. They haven't actually had the shot, not every resident.
No, it is my understanding they have had the shots. We're completed.
Oh, okay, cool.
It's good news.
Thank you.
Did you want to come back to that
We're
question?
going to cycle back and to Nathan DeLong's question that the doctor will add to.
So the question was around why there were so few public exposure notifications. I believe specifically in Zone 7, there is a lot of household transmission in that area. So there wouldn't be a public exposure notification for people who are being infected inside households.
Thank you.
Thank you.
Callum Smith, Global TV.
Hi, Bruce. Thank you. My question is for Minister Shephard, and it's outside the COVID realm. Minister, can you talk about the cost savings associated with the province's switch to biosimilar drugs from biological? And I guess, what do you say to patients who are worried money might be prioritized over their health?
Well, as you know, New Brunswick isn't usually the very first province to make these switches, and so we've had other provinces that have certainly gone to biosimilars. It is, the New Brunswick drug plan is supported through taxpayer dollars, and it is sort of the drug plan of last payer. And so the fact is that biosimilars have proven not only to be as effective as patented initial drugs have been, but also that they can save a considerable amount of money to these drug plans. And it's going to take a while for us to see full implementation, but once we do, it should be about $10 million. And I think that we have to work with healthcare providers and our public as well to ensure that they're getting the results they need. I know it's concerning. I probably would be concerned if my drug was going to be switched. But we use generic drugs as easily as we do other brands, and this is in the same context of that.
Mr. Smith, do you have a follow-up?
Yes, thanks, Bruce. Minister, as I'm sure you're aware, Crohn's and Colitis Canada is asking for at least a delay on this move until post-pandemic, because they say if patients don't react well and do present enhanced symptoms as a result of the switch, it will only add more strain to the healthcare system. Is a delay being considered, and would any patients be exempt or still have provincial coverage beyond the, at least as of now, November 30th date?
I'm not aware of any delays in implementing the plan. It is only for the New Brunswick drug plan. Anyone else who has their drug coverages can look into it with their drug coverage companies. But there's, again, many provinces have gone before us, and the results have been good. There hasn't been any real cause for concern that's been presented to me. So I will just mention that the one drug for Crohn's and colitis is Stelara. And I need to reassure that this is not included in the biosimilars initiative because there aren't any biosimilar brands for this drug. So I hope that gives a bit of comfort, and I hope that as this proceeds, we want it to be successful, and we're basing our decisions on those provinces who have gone before us and the health information, Canada Health information that we have.
Thank you.
Thank you.
Thank you both. Merci beaucoup, Ministre Shephard et Dr. Russell. Thank you, Mr. Shephard and Dr. Russell. That concludes today's update. Voilà la fin de notre mise à jour. Merci beaucoup à tout le monde.